So my name is Peter Ireland and I'm a respiratory registrar in the North East and also obviously here in the North West in Carlisle. Yeah, so this is Cumberland Infirmary, which is one of the hospitals here at North Cumbria Integrated Care. On this floor we have the respiratory ward, which is one of the wards that I work on. So because it's quite a small hospital, Cumberland Infirmary, everyone tends to know each other, which is really nice. All the consultants are really friendly and approachable, and it means that you're always supported when you need it. My interest started in medical school. So respiratory medicine is a really key part of the medical curriculum, and it meant that I rotated around lots of different respiratory wards and respiratory departments, and I found that all the people I came across, the respiratory consultants, the registrars at the time, and the rest of the healthcare body, so physiotherapists, specialist nurses, were just such excellent healthcare professionals. I really felt like they were a group that I wanted to work with. A lot of my week will be spent on the respiratory ward, supporting the junior doctors and the consultants there. So this is the pleural procedure room here on the ward, which as a respiratory registrar you actually spend quite a lot of your time doing thoracic ultrasound and then pleural procedures, so things like putting in Seldinger chest drains or doing therapeutic aspirations to help relieve patients of breathlessness associated with their pleural effusions. We're here outside Cumberland Infirmary, so we're just outside where there's actually plenty of green space just over where you can come and grab a coffee, get a break. Also not far from the river, where I often kind of run along in the evenings just to de-stress after a day at work, which is always nice. We also do a lot of outpatient work, so particularly at the moment here in Cumberland Infirmary, I do a lot of lung cancer care. So that's seeing patients with new diagnoses of lung cancer, speaking to them and their families and breaking that news and talking about what investigation and management plan would be. It's a really rewarding specialty. You can do a lot for a patient group which is often quite disadvantaged and sometimes overlooked. The training is fantastic. You're extremely well supported by consultants and other registrars, and overall everyone seems extremely happy in the training programme, and I think being happy at work is really important. Newcastle is such a fantastic city. It kind of has this big city feel, yet in a smaller city that's easy to get around, that's extremely friendly. We love getting out into nature, going out to Northumberland, hiking, walking. We love going out to the coast, doing kind of surfing or paddleboarding, and I just think this part of the country has it all, really. So if I had to use one word to summarise my time living and working in the North East and North Cumbria, I'd have to cheat a little bit and use two words and say endless opportunity. Whether that's the opportunity to have a fantastic career, work with fantastic consultants, nurses and other allied healthcare professionals, get a brilliant quality of training, but also a brilliant quality of life, whether it's the opportunity to buy a property, meet fantastic people and just make a really great life for yourself here.